Anemia by Vanessa May Muntigao, John Patrick Naag, and Wilson Isoso. We all know that red blood cells or erythrocytes are the most common type of blood cells. RBC or erythrocytes carry oxygen to the body tissues via circulatory system. RBC are perfectly designed to perform this oxygen carrying function. In this lesson, you will learn more about what makes the RBC so good of their job. You also discover when the oxygen carrying ability of RBCs is compromised. The reason why mature RBC is so good at carrying oxygen is because they make room by eliminating their nucleus. Immature RBC has the nucleus and allows it to reproduce. And when it's mature, this nucleus disappears, making more room for hemoglobin. Hemoglobin is the oxygen-carrying pigment of red blood cells. So, let's dissect the word. Hemoglobin. Hemo means blood and globin means protein, which makes up hemoglobin as protein in the blood. Each iron-containing hemoglobin molecule is responsible for transporting the iron to your blood, and interestingly, hemoglobin is bound to oxygen. That gives your blood its bright red color. Now we know that red blood cells are plentiful, and all their numbers are important. It is the amount of hemoglobin that they carry that determines how efficiently oxygen will circulate to your body. The more hemoglobin molecules found within your RBCs, the more oxygen they will be able to transport. The decrease in oxygen carrying ability of the blood results in a condition called anemia, decreased number of red blood cells, and decreased amount of hemoglobin. Anemia is an easy term to recall if you remember that the prefix "an" refers to without or lacking, and "emia" refers to blood. So anemia literally means without or a lack of blood. There are few things that can also decrease the number of red blood cells. One way that seems the most obvious is the massive loss of blood or hemorrhage. Hemorrhagic anemia. Anemia due to an excessive loss of red blood cells through bleeding. This blood loss may be caused by wounds or can also result to something going on internally such as stomach ulcers or heavy menstrual bleeding. Blood cells do not have to be lost to cause anemia. Sometimes there is a problem with their production. Red blood cells are formed in the bone marrow. Bone marrow, the connective tissue that fills the cavities of bones, and it is the chief site of red blood cell formation. Destruction or inhibition of red bone marrow results in aplastic anemia. Aplastic anemia is a disorder which the bone marrow fails to make enough blood cells. Aplastic anemia is a serious condition and can develop in any age. The cause might be idiopathic. Aplastic anemia could result from radiation, chemotherapy treatment, or exposure to toxins or medications. Pernicious anemia is another type of anemia that involves deficiency in the production of red blood cells, but unlike aplastic anemia that involves the bone marrow. Pernicious anemia involves the absorption of vitamin B12. Therefore, we define pernicious anemia as the disorder in which the body cannot make enough red blood cells because the intestine cannot properly absorb vitamin B12, and your body needs the vitamin B12 to produce RBC. Vitamin B12 is a nutrient found in a certain food that you eat such as meat, poultry, shellfish, eggs, and dairy products. The people who have pernicious anemia cannot absorb enough vitamin B12 from these foods because they lack intrinsic factors. So intrinsic factor is a special protein made in the stomach that helps your intestine absorb vitamin B12. When your stomach does not make enough intrinsic factor, the intestine cannot properly absorb vitamin B12. Interestingly, the word pernicious means that even though pernicious anemia is usually easy to treat with today's modern medical advancement, but some patients still die because of it. Anemia can sometimes result due to a genetic disorder, which is the case of sickle cells. Sickle cell anemia occurs almost exclusively in black people of Africa. described as a severe hereditary form of anemia, in which the red blood cells are sickle-shaped due to an abnormality in their hemoglobin. Normally RBC are round and flexible, which helps them to squeeze the tight capillaries without getting stuck. In the case of sickle cell anemia, however, some of the RBCs become stiff and sickle-shaped. The abnormal shape and stiffness of the sickle cell RBC makes them more likely to get stuck in the blood vessels and cause blockage that can result in severe pain and organ damage. These abnormal sickle-shaped cells can only circulate about 10 to 20 days. Instead of the typical RBC. 120 days, the body cannot make enough RBC to keep up with this space in this rapid turnover, and so the result is anemia.
Iron deficiency anemia. Anemia due to a deficiency in iron. It is a type of microcytic hypochromic anemia. But doesn't you already know? Because of this diagram in which you saw that iron is really important component of heme, and heme is centrally half of hemoglobin. So that if you don't have iron, you certainly can't make heme, and without heme, you can't make hemoglobin. And anytime you have a problem with making hemoglobin, you end up with a microcytic anemia. And microcytic anemia refers to an anemia where you end up with small red blood cells. So what is that happen? It's just as something happened by accident? No, it's something that the body does intentionally. So in any condition where you have a problem with making hemoglobin, such as with iron deficiency anemia, you end up with these red blood cells that have fewer hemoglobin molecules than they should. Increased blood loss, heavy menstruation, peptic ulcer, colon cancer is the most common encountered in elderly patients because the patient does not notice that there is blood loss in the gastrointestinal tract in theirs too. There are two ways that you can end up with a problem with the absorption of iron. The first way is decreased stomach acid, and second may be a problem in the duodenum or celiac disease. Another cause of iron deficiency anemia is the decrease in the absorption of iron. When you take an iron through the diet, it goes in the mouth, through the esophagus, through the stomach, and through the duodenum. And the duodenum is the point where you really absorb almost all of your nutrients, including iron. But before iron make its way through the duodenum and absorb in the duodenum and thus go to stomach, and it's really important for the iron to pass through and into the stomach because stomach contains lots of stomach acid. And the stomach acid is essential for converting the iron that you take into your diet into a form that is easily absorbed through the duodenum. Causes of iron deficiency anemia. When you usually think of iron deficiency, you're probably most likely to think of a person who isn't taking enough of iron through their diet, so you're probably most likely to think of decreased intake or decreased dietary intake. And we get iron through the diet and foods like green leafy vegetables and meat. So certainly somebody who's taking enough quantities of this kind of food will have iron deficiency, but really decreased intake is most problematic in infants, especially those in less than 6 months old. Because when you're younger than 6 months old, your diet is consists of almost entirely breast milk. And breast milk is really a poor source of iron, and that's why it can lead to decreased iron or iron deficiency anemia.